It's Dr. Jeff here with you today. Today we're talking about strains and sprains. I get this question here all the time. What's the difference between a sprain and a strain? And you're dealing with different types of tissues here. With a strain you're dealing with more of a muscle tendon type of issue, whereas a sprain you're dealing with a ligament. And the way I like to remember it is the tendon has a T in it, and that deals with a strain, whereas a ligament doesn't have a T in it, so it deals with a sprain. So if you're looking at a foot, you're going to have a tendon running down here to the Achilles. That actually makes the foot go up and down, so it creates movement is what it does, whereas a ligament prevents something from going too far. So a ligament will keep you from rolling your ankle too far. So a ligament actually prevents action, whereas a tendon actually creates action. When you're dealing with sprains and strains, there's a classification system for them, usually first degree, second degree, and third degree. A first degree type of sprain or strain is generally where something has just been pulled. So it's like walking down the sidewalk, you kind of roll your ankle a little bit, but you get up, you keep walking, you kind of walk it off. Or you're out raking or doing something in the garden, you kind of feel something pop in your shoulder or something's not quite right. And generally, within a week or two it goes away. You can ice it, we can do a little laser therapy on it to try and actually help it out. A secondary sprain is actually where you actually torn something. So usually within 5 days you'll get some bruising. So after 3 to 5 days you're starting to get some bruising. That's generally a sign that you've torn something that requires therapy. And that would be a second degree type of sprain or strain. A third degree is actually where you've torn something. So you've actually taken that ligament, you've actually torn it apart, or that muscle's been torn apart like a tear of your rotator cuff or a tear of your Achilles tendon. That requires surgical intervention. And that's something that here we have to refer you out for that. So those are your three classifications as far as sprains and strains are concerned. So if you come in with a first degree or second degree type of sprain or strain, generally we'll do some IFC on it, interferential current, try and pump the swelling out. We'll use some laser therapy, which is really good at dealing with it. Works microscopically to heal the cells up. And we work on the first and second degree type of sprains. The third degree sprain, we just can't do much with here. But certainly first and second degree sprains we can actually treat for you. When it comes to a first degree type of sprain or strain, usually that will clear up within the first week or two. But a second degree sprain requires more therapy. That's going to take between 2 to 6 weeks. It requires a laser therapy and stuff, but we actually have to rehab that. So here we use something like this to actually have you step on to try and balance yourself and create better proprioception. We give you some stretching bands or some exercises to do to try and actually strengthen the area up, to try and improve the strength in the area, because when you tear something, we have to get the strength back in it and prevent the scar tissue from forming. A third degree sprain or strain, that's something that again we send you off to see the surgeon with, and there's nothing which we can do here afterwards. We can do some rehab with you, but as far as treatment is concerned, there's not much we do with that. I'm Dr. Jeff. I hope you enjoyed our talk about sprains and strains. If you like this video, share it with your friends. I'm Dr. Jeff, and I've got your back.